I'm Helen Baxendale. I'm the Clinical Director for Exemplar Healthcare, a healthcare group that look after people with complex needs. Radar Healthcare has massively improved the way that we can track and report data. Prior to the implementation of Radar Healthcare, we could only really track and report on data every 4 weeks, when the whole team of people actually sat and looked through spreadsheets and counted incidents manually to actually then report on them to the organisation. We can now do this in real time. Absolutely has revolutionised what we do at Exemplar Healthcare. So Radar Healthcare has helped us track incidents such as medication incidents. And when I say incidents, that could be a process incident, or it could also be an actual error that could cause harm to people. So it's given us that ability that we didn't have before. We could only actually track incidents every 4 weeks. Now we track them in real time, which actually gives us that opportunity to react really quickly and reduce risk of harm to people. So our frontline staff have seen the benefits of the system immediately. It's reduced a very laborious incident reporting system that we currently had, but it's also the simplicity of the system and their ability to actually use it at the front line. And everyone, I think I could say 100% everybody has been really positive about the rollout of the Radar system. Radar Healthcare, using the QR codes for the staff to actually link into the system, has just made it so much simpler. You know, we've tried to focus on making this whole process simpler for our staff. We've listened to feedback, and one of the pieces of feedback from the staff is around the simplicity and actually using the QR code, and we're using it for a number of other things as well, has really supported that transition to a digital platform across all of the systems that we're using. Radar Healthcare has been totally justified within the organisation. The investment into this system has been totally justified. I joined the organisation 6 years ago, and we were fully paper-based. And I have waited for a good couple of years, obviously COVID was in the middle of that, to actually introduce a system that would make everybody's lives simpler, but more importantly, reduce risk of harm to both our service users and our staff. And Radar Healthcare has definitely supported us to do that. Radar Healthcare has been part of our digital journey, but very clearly we've done an awful lot of other digital transformation within the organisation. So we started with EMR, and that was very much about reducing medication errors and issues, which was one of the key focus of my vision when I joined the organisation, because that was probably our biggest risk at the time. We then introduced Radar Healthcare for incident and complaint management, and we are now transitioning other things onto the Radar platform. Our staff have found it extremely easy to use, and so we took the decisions to move our health and safety audit onto the platform. We are now looking at our clinical audits moving onto the platform, and also we are using the Nourish system, which we are halfway through our rollout across the organisation. And actually, once that can link into the Radar Healthcare system, then we feel we'll have a platform that integrates everything that is around risk reduction and reducing harm to people. We've also got an electronic rotoring system and a few other systems that actually link in across the organisation, but by the end of this year, 2024, we will have a fully digitalised platform across the organisation. We've made quite a few changes in the way Radar works for us. So, for example, we've introduced a choking risk register. So we had a choking incident that clearly we had to learn lessons from. So actually the introduction of the choking risk register within Radar has really supported us to be able to monitor issues in particular services where we have high incidence of choking events. We've also introduced a deprivation of liberty register. So there's many ways which we've actually, now that Radar is really becoming quite embedded into our organisation, that we can actually have started to work with Radar Healthcare to configure it in a way that actually supports us with the biggest risks that we've got, which is something that I think when we started the journey with Radar Healthcare, potentially we hadn't really thought about. And now what we're seeing is added benefits to that, which is really important. When we were looking for a digital system for incidents and complaints specifically, obviously we had demonstrations from a few organisations, and I think the reason we went with Radar Healthcare is because it seemed very simple to use. And when you're introducing a digital system into an organisation where you've got people that are not really that used to using digital systems, to actually then introduce something that looks and feels simple, even though it's something they've not used before. And actually, from an instant perspective, we had to change our processes. I think it gave us that feeling that actually people would accept it, where some of the other systems looked a little bit, I suppose, clunky, old-fashioned. The workflows didn't look as easy. And so once we'd had all the demonstrations, then we took the decision to go with the one that we felt would be accepted by all levels of staff within the organisation. And very clearly we made the right decision because the Radar Healthcare rollout within our organisation has been quite seamless. My advice to anyone thinking about developing and implementing any system into an organisation, Radar Healthcare being one of them, really plan how you're going to do it. It's very easy to say, oh, we'll just roll it out. But actually, my experience of rolling out any digital system is to invest the time in your staff training. And that's not just about sitting them in front of an electronic platform where they look at videos on the platform. It is actually go out there and talk to them, deliver training face to face, and not just training about the system, but about the processes. Because if you can get them to understand the processes that are being implemented and the reasoning behind that, and what risk management is all about, because within our organisation, people know about, they talk about risk, but do they really know what risk management is? Do they really know how to rate a risk? Actually, to invest the time in going out and doing face-to-face training. So make sure that the system is embedded really right from the beginning, not just let's get it in there and then fix it afterwards, because it's much more problematic when you try to fix things afterwards. So we've had a team of implementers throughout all of our digital transformation, and they actually go to the services and they actually support the staff while it's integrating and then afterwards. The documentation and the tracking of incidents since the introduction of Radar Healthcare at Exemplar Healthcare has changed immensely, really. So prior to Radar Healthcare coming into our organisation and being integrated into the organisation, everything we did was on paper. So being able to track incidents and then react to that, to the problems that have been highlighted, is now in real time, which we never had before. And we've made the actual instant reporting system much simpler for people, which actually then means I feel that people follow the process much more closely, which again, it's all around outcomes, isn't it? All of this affects the positive outcomes, both for staff and for service users. So we have completely revolutionised and changed the way that we report incidents and complaints because of the integration of the Radar healthcare system. So Radar Healthcare has increased our response times 500,000%, really, because we can respond within 24 hours, within an hour, within actually sometimes within minutes. If an incident is logged and due to the hierarchy that's in the system and we get alerted to an incident that is really serious, we can react immediately. Which we did not have that ability. We had to rely on people picking up the phone, ringing the relevant people, being able to get through to the relevant people so that we could react. So this has really given us a platform that we can react with immediate response if required, if that is what is required. Yeah, so lessons learned and tangible events within Radar. So we monitor most of the trends and themes that come out of Radar through Power BI. And we have reporting, we can now see that on a daily basis. So obviously as part of the workflow within Radar, at the end of the workflow is a lessons learned. So again, we did not really have visibility of that at central level through our old adverse event reporting system. So we can now pull out the themes and trends from the lessons learned and use that organisationally or within areas or within the care home. I've been to a number of our homes whereby our home manager and clinical nurse manager use Radar at our daily Take 20 meetings. So they talk about any incidents that have happened over the past 24 hours. And within that, they talk about any lessons that are needed to be learnt locally once they've gone through the workflow of the incidents that have arisen. So again, this system has helped us revolutionise how we as an organisation can actually share learnings across the whole organisation in a really timely manner. So if an incident's occurred and the home has gone through the workflow, we can share a lessons learned within a few minutes or an hour of actually the incident actually occurring across the rest of the organisation. Prior to Radar Healthcare being introduced, complaints and compliments were really managed at home level. And through our own internal audit process, we could then monitor what complaints and concerns and then compliments were being seen at individual home level. Up to that point, we couldn't see them as an organisation. So again, what we've started to do is report on that. So obviously we report on complaints and we look at themes and trends from complaints because again, we can learn lessons from those things. But we never looked at the positive, which is actually, for our staff and our frontline staff and our homes and their home managers, to be able to now report on compliments as an organisation and actually discuss those at our executive meetings, at board meetings, that's brought some really positive affirmation of actually what the homes do on a daily basis, which is amazing. And we couldn't really see that before. So Radar's given us that platform to actually be able to see that.